Hi, my name is Quincy George, and this is my physical assessment video. This is my volunteer, Roxanne Blazina. Roxanne, I just want to make sure it's okay that I film this and then post it online.
It's okay.
Okay. Hi, Roxanne. My name's Quincy. I'll be your nurse today. Can you tell me why you're here today?
I'm here for a yearly physical.
Okay. I've already washed my hands, but I'm going to go ahead and use some hand sanitizer. Can you tell me your name and date of birth?
Roxanne Blazina, 6560.
Okay. And Roxanne, where are we at right now?
At the Lock Haven Clinic.
Okay. And can you tell me the year and month we're in?
It's 2018 and we're in September.
Okay. Client appears to be in no distress. Posture seems to be good within normal limits. I'm going to go ahead and I'm going to start by getting your vital signs. Any other complaints that you have?
No.
Okay. If I had a height rod and a scale, I would then use that to get the client's height and weight. I'm going to start by getting your pulse.
Okay.
Okay. We'll start with this.
Yep.
Good. Nice strong pulse. Good. I'm just going to feel your brachial pulse here. And I'm going to check this one as well. Good. I'm going to go ahead and I'm going to get your blood pressure.
Okay.
And then I will get your temperature after that. Any other complaints that you have?
Nope.
Okay. Go ahead and relax your arm for me. Good. Good. 124/82. Okay. And we're going to go ahead and get your temperature here. Good. 98.6. Oops. That's okay. All right. I'm going to start by assessing your upper extremities, the skin. Throughout my assessment, I'll work the skin in with each system, okay?
Okay.
Have you noticed any swelling or change in your skin?
No.
Good. Good. I'm going to go ahead and just check for capillary refill. This is the amount of time it takes for your blood to return to your nails after I apply pressure. Good. Good. And now I'm just going to test for skin turgor. That's
Okay.
just lets us know the elasticity of your skin and if there's any dehydration. Good. 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 Okay. Next I'm going to go ahead and I'm going to just assess your head, okay? Have you noticed any hair loss?
No.
Good. Any headaches? Any vision changes?
No.
Okay. Any dizziness?
No.
Good. Just going to feel your scalp. Good. Any pain when I press here?
No.
And how about here?
No.
Good. Just checking sinuses. Go ahead and open your mouth for me. Good. And again. Good. Okay. Go ahead and smile for me and frown and raise your eyebrows. Great. Okay. Next I'm going to go ahead and look at your neck. Have you noticed any swelling of your throat or in your neck?
No.
Okay. Just going to feel your lymph nodes here. Good. Trachea is midline. Going to go ahead and test your range of motion, okay? Go ahead and look down for me and up and to your left and back in the middle and to your right, back in the middle and to your side, yep, and your head to your right. Good. Okay. Now I'm going to go ahead and I'm going to feel for your thyroid. I'm going to have you take a glass of water here and I'm going to have you turn to the left first, take a drink, and I should feel your thyroid rise, okay?
Okay.
Okay, go ahead. Good. Great. going to go ahead and take a look at your eyes. Have you noticed any change in vision? Any
No.
double vision?
Mm-mm.
Okay. Any drainage, redness from your
No.
eyes? Okay. I'm going to start by checking your peripheral vision.
Okay.
I'm going to have you occlude your left eye.
Okay.
And I'm going to occlude my right, and I'm going to bring my fingers in from the side, and you tell me when you see them. We should
Okay.
see them at the same time, okay?
Okay. I see him.
Okay?
No.
Good?
No.
Good. And we're going to go ahead and switch to the other side.
No.
Good?
No.
Good?
No.
Good. Okay. And now I'm going to go ahead and take a look at your cornea reflexes here. Just go ahead and stare straight for me. I'm just going to put my pen light right in between
Okay.
your eyes. Good. And reflection is the same in both eyes. If I had a Selin eye chart, I would then use that to test for the patient's visual acuity. I'm going to go ahead and I'm just going to test your pupil's reaction to light, okay? Good. And go ahead and look straight at me. Good. And I'm going to have you follow my finger through the 6 cardinal signs, just with your eyes. Good. 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 Okay. And follow my finger into your nose. Good. If I had an ophthalmoscope, I would then use that to assess the internal structures of the patient's eyes, like the cornea and the retina. Now I'm going to go ahead and take a look at your ears. Any pain in your ears?
No.
Any discharge?
No.
Good. Any pain when I press?
Mm-mm.
Good. If I had an otoscope, I would then use that to look at the internal structures of the patient's ears, like the tympanic membrane, assessing for color, integrity, and position. I'm now going to go ahead behind you and perform the whisper test.
Okay.
I'm going to have you occlude one ear at a time, and I'm going to whisper 3 words to you, and I would like you to repeat those back to me, okay?
Okay.
Go ahead and occlude your left ear first, and I'm going to whisper to you. Red dog cat.
Red dog cat.
Good. Okay, and switch. I see you.
I see you.
Good. Okay. If I had a tuning fork, I would then use that to assess the Weber test, making sure vibration and sound is heard equally in both ears, as well as perform the Rhine test. I'm going to go ahead and look at your nose now. Any frequent colds, any nasal discharge that's new?
No.
Good. Any trauma to your nose?
No.
Good. Good. Nose is midline. If I had an otoscope, I would also use that to look at the internal structures of the nose, checking for any deviated septum or nasal polyp. I do have my pen light, so I'm going to go ahead and take a look with that. Good. Okay. Septum is midline, and no nasal polyps that I've noticed. Roxanne, I'm now going to go ahead and take a look into your mouth.
Okay.
Have you noticed any bleeding gums?
No.
Any lesions or lumps in your mouth that are new?
No.
Any toothaches?
No.
Do you wear dentures?
I do, partial.
Okay. All right. I'm going to go ahead and take a look in your mouth. Any change in taste?
No.
Okay. Good. And lift your tongue up for me. Good. And I'm just going to lower your lip here and look through your gums. Good. And same with the upper. Good. Okay. I'm now going to use a tongue depressor here, and I'm going to have you stick your tongue out and say ah for me so I can look in the back of your throat. Go ahead and look. Yep. Good. And one more time. Good. Okay. Uvula is midline. Tonsils are present, +1. I'm now going to have you stick your tongue out for me again and go ahead and lift it up and down, side, to the other side, and a circle if you can. Good. Okay. I'm just going to go ahead and take my gloves off and just wash my hands with some hand sanitizer. And then we're going to go ahead and assess your lungs.
Okay.
Any frequent respiratory infections?
No.
Any cough?
No.
Do you smoke?
I do.
Okay. And about how many packs of cigarettes
A little
do you
less
smoke?
than a half a pack a day.
Okay. Have you tried to quit?
I haven't.
Okay. Would you like some information on
I
how to
would.
quit? Okay, good. We'll make sure we get you set up with some pamphlets and
Okay.
some counseling if you would like for how to quit smoking.
Okay.
Okay? All right. I'm going to go ahead and start with the back. I'm going to just swivel you to the right here a little bit. Good. And I'm going to put my hands on your back, and I'm going to have you take a nice deep breath in, just checking for symmetry, okay? I'm going to have you lean forward just a little bit. Good. Nice big deep breath in. Good. Good. Okay. C7 here. I'm now going to go ahead and I'm going to put my hands on your back, and I'm going to have you say 99, just checking vibration, making sure it's equal in both lung fields, okay?
Yep.
Go ahead.
99.
Good.
99.
Good.
99.
Good.
99.
And I'm going to have you lean up just a little bit. Okay, go ahead.
99.
Good. And now I'm going to go ahead and I'm going to percuss over your lung fields.
Okay.
Good. 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 Going to have you lean up just a hair. Good. Okay. And now I'm going to go ahead and I'm going to take a listen to your lungs, okay?
Okay.
Nice big deep breath in. Good. Deep breath in. Good. Good. Deep breath in. Good. 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 And one more. Good. Okay. I'm just going to go ahead and come to the front and we'll do the same thing, okay? Okay. Nice big deep breath in. Good. Okay. I'm going to go ahead and put my hands on your chest and have you say 99.
99. 99. 99. 99. 99.
Good. Now I'm just going to go ahead and percuss over your lung fields. Here's the substernal notch and the angle of Lewis. I'm going to go ahead and take a listen now. Nice big deep breath in. Good. Deep breath in. Good. Deep breath in. Good. Deep breath in. Good. Good. And one more for me. Good. Okay. Now I'm going to go ahead and I'm going to assess your heart. Have you noticed any chest pain?
No.
Okay. Any feeling of tiredness?
No.
Good. Any new onset of swelling?
No.
Good. I'm going to go ahead and just take a look at your chest, and then I'm going to feel for your apical pulse, okay? Okay. Good. I'm just going to feel here. Good. Okay. I'm now going to go ahead and feel your carotid arteries. I'm going to do one at a time.
Okay.
Good. Good. Also noting at the same time any jugular vein distension, and none is noted. If I had a ruler, I would then use that to estimate the jugular venous pressure. I'm now going to go ahead and I'm going to take a listen to your carotid arteries.
Okay.
And then I'm going to take a listen to your heart, okay?
Okay.
Good. Good. Okay. Just going to come to the side here and take a listen to your heart. Heartbeat is nice and strong, 76 in a normal rhythm. Now we're going to go ahead and just take a look at your upper extremities again. We're going to assess your joints, okay? Have you noticed any pain in your joints?
No.
Any swelling? Okay. Good. just checking each finger here. Good. And we're going to go ahead and do the same thing on this side here. Good. 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 Okay. Next, we're going to test the range of motion of your arms. We're going to do one arm at a time. We'll start with your right, okay? I'm just going to have you raise your arm all the way up and back down to the side and to the, yep, good, and back to the side. Go ahead and put it behind your head and then behind your back if you can. Good, and back down to your side. Go ahead and touch your arm to your shoulder. Good, and back down. Good. I'm going to have you lift it up like this. And I'm going to have you flex your wrist down and back up into the ceiling. Good. And then back, yep. And I'm going to have you go inward and then back outward. Good. And now just your fingers, flex them down and then back to the center and to the top. Good. Okay, go ahead and put your arm back down. I'm going to have you raise it to the side here and then out in front of you. Good. And back down to the side. Good. And we're going to do that on the same arm, or the other arm, okay? Same thing. Lift all the way up and back down to your side and all the way out back. Good. And back down to your side. And then go ahead and lift it straight out and then bring it across in front of you. Good. And back down to your side. Good. Go ahead and touch your hand to your shoulder. Good. And back down. And then go ahead and lift your arm up and then flex your wrist down and back into the, yep. And to the top, good, and then in, back to the middle, out, okay, good. And now go ahead and flex your fingers down, and back to the center, good, and up to the ceiling, good. Okay, now going to have you just meet your hands together like this, good, and I'm going to go ahead and percuss your medium nerve. You can go ahead and relax, and this is just right over your wrist here, good, good, okay. I'm going to go ahead and test your strength now. I'm going to have you squeeze my fingers. Good. And then put your arms straight out in front and raise them against my resistance. Good. And the same thing, we'll do it this way. Yep. Go ahead and lift up. Good. Okay. Now I'm going to have you press each finger with your thumb like this. Good. And then back. Good. And with this hand. Good. And then back. Good. Okay. And now I'm going to have you touch your nose and then touch my finger, okay? Good. And touch your nose. Good. 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 Okay. That's all I have for the upper extremities. Now in the exam, if this was a real physical exam, I would do a breast exam on my patient, but for the purpose of this video, I'm just going to educate my patient on how to do a self-breast exam. Roxanne, do you do self-breast exams?
I do.
Good. Okay. Do you know the proper techniques to do them?
I do.
Okay. We're just going to go ahead and review them, okay? The best time to do them, since you are postmenopausal, would be the same time each month. So picking a day that kind of works for you. And you can do them in the shower or once you get out of the shower lying down, okay? Okay. So what you're going to do is you're going to take the first 3 fingers of your right hand and you're going to examine your left breast, okay? You're going to put your hand behind your head and you're going to go in a circular motion. And you're going to use different types of pressure, light first and then deep pressure, okay? And the purpose of this is so you can become familiar with your own breast, noting any change in color, shape, or size, any lumps or lesions, okay? And then you're going to do the same thing and go under your arms in a circular motion using different types of pressure. And then you're going to go ahead and switch and do that on the other side, examine the other breast. And then finally, you're going to want to stand up and look into a mirror with your hands on your hips, slightly bent forward, examining your breasts, noticing any change in shape or size. And you want to make sure you let your doctor know if you notice any changes, okay? Okay. At this point in the exam, we're going to have you lie down, help you lie down here. Yep.
Ooh, this is a pretty comfy couch.
And I'm going to go ahead and I'm going to take a look at your abdomen. I'm just going to go ahead and start by just examining, and then I'm going to take a listen, okay?
Yep, all right.
Yep, that's good. Any pain in your abdomen?
Nope.
Okay. Any nausea or vomiting?
No.
Good. Okay. Just going to take a listen here. Good. Good. And now I'm going to go ahead and I'm going to percuss over your abdomen fields, okay? And I'm also going to percuss over your liver. Good. I'm going to go ahead and percuss over your liver here. Good. If I had a ruler, I would then use that to measure the liver span. I'm now going to go ahead and I'm just going to have you sit up for me, and I'm going to percuss your kidneys, just making sure there's no tenderness.
No.
Any tenderness?
No.
Good. Okay, I'm going to have you lay back down for me. And now I'm going to go ahead and I'm going to palpate over your abdomen.
Okay.
I'm going to use light pressure first and then a little bit deeper pressure, okay? And you tell me if you have any pain. Any pain?
No.
Good. I'm going to go ahead and use a little bit deeper pressure. Good. If the patient had any signs of acute appendicitis, I would then check for rebound tenderness. I could also do the test, the ileopoiesis test, and the obturator test as well. I'm going to go ahead and percuss over your liver. Or, I'm sorry, palpate over your liver. Good. Any pain?
No.
Okay. If the patient had any signs of acute cholecystitis, I would check for the Murphy sign. Now I'm going to attempt to palpate the spleen. Normally you're unable to feel it, and I do not feel it. And now I'm just going to go ahead and feel your kidneys. Okay. Good. Okay. Any pain or anything while I was doing that? Good. Now I'm going to go ahead and I'm just going to look at your lower extremities, okay? Yep, I'll just have you pull those up for me.
I have some problems with, so.
Okay.
Yeah.
I noticed in your chart you had some a history of cellulitis. Okay. Was that in the left leg here?
Yeah.
Okay. Are you currently taking anything for
I
that?
am, and then I have a hammer toe on that one.
Okay.
I am now taking prednisone again.
Okay.
So I'm taking prednisone and then just a baby aspirin.
Okay. Good.
So the prednisone has been keeping the swelling down.
Good. Okay. But no new swelling that you noticed.
No, and
okay.
then no open areas that I can see, and I don't.
Nope, I don't see any either. Okay.
No.
I'm going to go ahead and I'm going to feel for your pulses.
Okay.
Normally I would start with the femoral pulse, but for this video I'm going to go ahead and start with the popliteal pulse. Good. And just work my way down here. Good. And the top of the foot. Good. And I'm just going to do that on the other leg here. Yep. Good. 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 Okay. And now I'm going to go ahead and just feel your joints while I'm here, okay? Any pain with your joints?
I have a little trouble with this knee
Okay.
once in a while, but
Do you take anything for that?
normally I just take a Motrin if it gets to bother me too much.
Okay.
I'm pretty sure it's probably arthritis. I had an injury. I don't know if I remember to put that on my thing, I hope. But it wasn't, I didn't have surgery or anything. I probably should have, but.
And does your toe seem to bother you at all, or does
No,
that? Okay, good. I'm now going to go ahead and I'm just going to feel for any swelling or any edema, okay? Good. Good. And now I'm just going to test for the Homan sign. I'm just going to put my hand underneath your calf and flex your foot forward. Good. Any pain?
No.
And any pain with this one?
No.
Good. And now I'm just going to go ahead and use my pen light and I'm going to test for the Babinski reflex, okay? Good. Good. Okay. Now I'm going to have you lift one leg up at a time. Go ahead. Yep. Good. And then the other. Good. And then knee to chest, one at a time. Good. Good. Okay. And go ahead and press your hands down on my feet. Good. Okay. Now I'm going to have you raise both your legs up against my resistance. Good. And then go ahead and push your feet down on my hands. Great. Okay. Now I'm going to have you stand up for me. Ugh. Good. Okay. And we're just going to have our hands at our side with our eyes closed, and we're just going to stand here for about 15 seconds. I just want to make sure there's no dizziness or anything with you just standing there.
Okay.
And you let me know if you have any.
Nope.
Okay, good. Now I'm going to go ahead and I'm just going to have you bend over.
Mm-hmm.
Yep, just like that, just checking your spine for alignment. Good, okay, and come back up. And then I'm going to have you take your arm and go to your right. Good. And then to your left. Good. And I'm going to have you twist just like that. Any pain?
Nope.
Good. And now I'm going to go ahead and just have you walk.
Okay.
Just looking at your gait and mobility.
Okay.
Good. Okay, good. And now I'm just going to have you can just sit here.
Okay.
I'm going to do the object test with you. I'm going to have you close your eyes.
Okay.
And I'm going to hand you an object, and I want you to tell me what that is, okay?
Okay. It's a key.
Good. Okay. And now I'm going to do the sharp and dull test. I have a stick here. One side is dull and one side is sharp. I'm
Okay.
going to do it on your arms, your
Okay.
legs, and your chest.
Okay.
I just want you to tell me when I rub it on your arm if you feel the dull or the sharp side, okay?
Okay.
Go ahead and close your eyes for me.
Dull.
Good.
Sharp.
Good.
Dull.
Good.
Sharp.
Good.
Dull.
Good.
Dull.
Good.
Dull.
Good.
Sharp.
Good. Okay. And finally, I'm going to go ahead and I'm going to do the cotton test. I'm going to have you keep your eyes closed. I'm just going to rub this over your extremities, and I just want you to tell me when you feel it. You can just say now, okay?
Okay.
All right.
Now.
Good.
Now.
Good.
Now.
Good.
Now.
Good.
Now.
Good. Okay. And at this point in the exam, if I had a reflex hammer, I would then use that to assess the patient's reflexes. Roxanne, I believe this is all that I have for you for your physical exam.
Okay.
Do you have any questions for me?
I don't.
Okay, well, make sure you get that information about smoking.
Okay.
And I'm going to also give you some information just with the breast exams, just
Okay.
for follow-up, okay?
Okay.
It was very nice
All
to
right.
meet you.
Thank you very
so
much.
much for coming
Thank
in.
you.